I'm John Hunter, Chief of Plastic Surgery at New York Methodist Hospital and Clinical Professor of Surgery at Weill Cornell Medical College. Today I'm going to discuss an interesting paper by Sieffert and colleagues entitled Obesity is Associated with Increased Healthcare Charges in Patients Undergoing Outpatient Plastic Surgery. The purpose of the study was to determine the relationship between obesity, post-discharge hospital-based acute care, namely ED visits or hospital admissions, and hospital charges within 30 days of outpatient plastic surgery. ASC databases from 4 states were analyzed, adults undergoing selected procedures were identified, and patients were grouped by the presence or absence of obesity. Overweight and obesity was identified if weight-specific ICD-9 codes or a BMI greater than 25 were noted in the patient's medical record. 47,741 discharges were included. 4.3% of the patients were overweight or obese. The authors found that overweight and obese patients were significantly more likely to have a hospital-based acute care encounter or an adverse event within 30 days of surgery. They also found that obese patients had significantly greater adjusted hospital charges. The authors' findings, if true, are important as they suggest that better preoperative medical optimization and better patient selection are needed when operating on overweight and obese patients to improve outcomes and decrease costs. The major flaw of the author's paper, however, is the small sample size identified as overweight and obese, only 4.3% of the patients. This does not remotely reflect the actual obesity rate in the U.S. population. According to the CDC, 63% of adults in the United States are either overweight and obese. Perhaps then only the super obese and those with obesity-related comorbidities were captured by the author's data. If this is true, then their findings may not be representative of the overall overweight and obese patient cohort, but rather just the subset captured with their data. Further analysis of the obese patient cohort could have been enlightening, but was not done, in part because of the limitations of administrative databases. Although further analysis is needed to validate their conclusions, Sieffert and colleagues are to be commended for this interesting paper. Thank you.